Hey everybody, Dr. James Fetich here, Clinic Director at Village Family Clinic, talking about our Myovision sEMG scan. So this is a scan, we literally just did this morning. It's a really cool scan, so I just want to show it to you and show you how this technology works. So years ago, chiropractors would x-ray a lot of patients, see what's going on with their alignment and things like that. We try to avoid unnecessary x-rays nowadays, and we do them if we need to in MRIs, but this technology can usually tell what's going on without that. So I tell people, remember from third grade, we got a brain, spinal cord, nerves jumping out either side. We take these little probes here and we just run them up and down the spine. There's no insertion, they just go up and down, and they read the electrical signals already in the spine. As it reads that nerve coming out of the spine, it gives us this cool chart. So we want to see green, that's the normal level based on the age and sex, and both sides equal. So your right and left side of your spine should be doing about the same thing. I tell patients, spines aren't like elbows where you have a right and left. You have one spine, and both sides should kind of do the same thing. So this side's good. Then the other first thing we look at, just to see the overall shape of the spine, is this number down here called the stress score. I tell patients a healthy spine is about 100 to 120 on the stress score. So we see when they came in. So this is a lovely patient of ours, hadn't been in a while, wasn't feeling too good, neck and back pain, and we did this scan about a month ago, and we'll see the pre and post. So here's where we did a month ago. Her stress score is 195. So 75 points above where I'd like to be. She's pretty fit and young, so even closer to 100. We're down to 195. You see the big red spikes are where these nerves are getting rubbed or irritated. And when I tell patients with these scans, imagine my finger is the nerve. The more I rub it, the more red and irritated it's going to be. So for example, at C6 in her neck, we had a 45. It should be about a 2 or 3, really irritated. T3, T5, 12s and 10s should be a 3 or 4. Down in the lower back, we got 15s, 9s, 11s, should be about a 5 in there. So we've got a lot of irritation in the lower back, a couple in the middle back, and one pretty bad in the neck. Here's the one we just did this morning. We see our stress score is down to 134. So we're almost within the normal range in about 3 weeks, which is pretty neat. We usually shoot for 40, 50 point drop on here. I'm happy with. This young lady dropped 60 points in 3 weeks, so that's really good. We're almost within the normal range now. We'll see we went from all this big reds to just a couple left over. So we'll see a couple reds, the middle back, 7, 8. Still I need a little bit of work to do there. The lower back went from 4 of these reds down to just 1 pink, so it's just a little bit irritated in there. And sometimes when you see yellow, sometimes that can mean there's some compression to the nerve. So this patient does have a lot of that. When we see really bad pinched nerves, sometimes we'll see, I tell people if we pinch my finger, the blood will stop flowing and it turns white. That's what can happen with the nerves too, and we'll often see these real low yellow readings where the nerve is being compressed or pinched in there. So we kind of tell, is it muscular, is it irritated nerves, tight muscles, a pinched nerve, possibly something like a slip disc, all by doing this scan. It just takes 2 minutes in the office. Totally painless, no side effects. We just touch those probes up and down the spine. We get a reading in just a few minutes, which can tell us what's going on, where to look for the problems. But what's really amazing is to see the improvement in a couple weeks. And this patient's done great in 3 weeks of care. She's almost back to normal. I told her a couple more, we'll be down to that 120 range. So it's a really great technology. See what's going on with your spine without radiation, MRIs, x-rays, getting pre-approval from insurance. We have 2 of these machines in the office. We do it real quick and easy. We can see what's going on with your spine. For more info, give us a call or text at 908-813-8200.